ladies and gentlemen. It's a great honor to join you today at the National Healthcare Quality and Innovation Summit hosted by the Oromia Regional Bureau under the timely and powerful theme, Harnessing Healthcare Quality and Innovation to Build a Resilient, High-Impact Healthcare System. This theme reflects not only aspiration, but necessity. Across the world, health systems are being tested by shocks that are no longer exceptional. Pandemics, climate-related emergencies, conflict, economic constraints, and raising public expectations are now part of the normal operating environment of health system. In this reality, resilience is not built by chance. It must be built deliberately into everyday systems, its design, leadership, and the practice. Quality as a foundation of resilience. Globally, we have learned a hard lesson. Expanding access without ensuring quality doesn't deliver better health outcomes. In fact, poor quality care is now recognized as a leading cause of preventable mortality worldwide. This means that resilience is not primarily about buildings, beds, or technologies. It is about systems that consistently deliver safe, effective, people-centered care, even under pressure. Ethiopia has recognized this through early. The national focus on healthcare quality, patient safety, innovation, learning system places the country firmly within the global movement towards high-performing health system. Based on this, Ethiopia is one of the African countries which really have achieved a lot of achievements, big achievements in these areas. Innovation with purpose, not novelty. Innovation is often misunderstood as technology alone. Digital tools, artificial intelligence, data platforms are important, but they are not innovation by default. Innovation is a disciplined application of new or adopted ideas that solve real problems in a short period, improve outcomes, and can be scaled and sustained. The sessions over the next 2 days, from digital health and AI to innovative financing and epidemic preparedness, shows that Ethiopia is increasingly asking the right question. Not this is now, but does this improve care? Does it reduce harm? Does it reach the most vulnerable? Can it be sustained within our system? This shift from novelty to value is essential. Countries that succeeded are those that embed innovation within governance, regulation, ethics, and accountability frameworks. Without this, innovation risks widening inequalities rather than closing them. Patient safety as a non-negotiable system property. No discussion in quality and resilience is complete without addressing patient safety. Unsafe care undermines trust, wastes resources, and erodes the every foundation of the health system. Unsafe care is not a marginal issue. It erodes trust, wastes scarce resources, and weakens system credibility. Ethiopia's engagement with the Global Patient Safety Action Plan through the Global Collaborative is therefore a critical step toward this reality. Ethiopia is among one of the 6 countries globally selected implementing patient safety initiative. We have a project which is successfully really reached to 1-year achievement among the 6 countries. The patient safety friendly hospital framework, which will be presented during this summit, reflects a global consensus. Safety is not an end-on, it is a system property. It depends on leadership commitment, a just culture leading from incidences strong and evidence-based clinical processes, and the meaningful engagement of patients and the families. In Ethiopia, we are already seeing promising examples. Hospitals participating in patient safety initiatives have strengthened incidence reporting, introduced safer clinical practice, and begun fostering cultures of learning rather than blame. There is no small changes. There is no small changes. They reflect the Health Sector Development Investment Plan, HSDIPS, emphasizes on leadership, accountability, and the continuous improvement. Similarly, again, Ethiopia's efforts in healthcare accreditation and quality improvement, including hospital networking, mentorship models, and national quality strategies, demonstrate how standards can be used not as punitive tools, but as levers for learning and performance improvement. When accreditation is linked to capacity building rather than inspection alone, it becomes a driver of resilience. From evidence to action. Another strength of this summit is its emphasis on evidence generation and the use. Data alone doesn't change systems. Evidence must be translated into decisions, policies, and frontline practices. The presence of researchers, implementers, and policymakers in the same space is not a symbolic, it is a strategic. Countries that improve faster are those that shorten the distance between data and action. They invest in learning health system where measurements, reflections, improvements are continuous and routine. A shared responsibility. Resilience ultimately is not proven during a crisis. It is revealed by how a system performs in routine care every day for every patient. Health systems that deliver safe, respectful, and effective care under normal conditions are the ones that withstand shocks when they occur. WHO, as a country, regional, and global levels, remains committed to supporting Ethiopia's leadership in this journey. Our role is to share global evidence, facilitate cross-country learning, and when needed, challenge assumptions that limit progress. True partnership requires both support and honesty. A call to action, a call to collective action. As this summit begins, I invite all participants to focus on three questions. WHO invites all participants to focus on three questions. Number one, first, how do we institutionalize quality and patient safety so they are not dependent on individual champions or short-term projects? Second, how do we ensure innovation serves equity rather than accelerating disparities? Third, how do we strengthen learning systems that consistently translate evidence into better care? The answer is not come from one speech, one policy, or one initiation. They will come from sustained collaboration, honest measurement, and courageous leadership. On the behalf of WHO country office, I commended the Oromia Health Bureau and all partners for convening this critical platform. We remain committed to working alongside Ethiopia in building a health system that is safe, innovative, resilient, and worthy of the trust of these people. Thank you very much.